Hi, today we're going to be talking about whooping cough in the healthcare setting. And I'm Jen.
And I'm Marianne.
So I'll start by describing what it is. So whooping cough is also known as pertussis. It's a highly contagious respiratory tract infection. Many people describe it as a really bad cough. It's marked as a severe hacking cough followed by an intake of a breath that sounds like a whoop. And I'm going to show you or introduce what it sounds like. So that's a little short example of what it sounds like. However, not everyone develops that characteristic. The disease usually starts with a cold-like symptoms or mild cough or fever. It affects children that are too young to be able to get the full course of vaccines. It is a very contagious disease that is found in humans and transmitted from person to person. Usually spreads by sneezing or coughing near another person, and that person inhales that bacteria. Those who get infected are typically infected by a sibling, a parent, or a caregiver who had no idea they had it in the first place. Symptoms usually develop within 5 to 10 days after being exposed. However, there are cases in which symptoms do not show up at all until 3 weeks later. It starts off as mild upper respiratory tract and is similar to the common cold. About a week or two later, the symptoms become worse. An accumulation of mucus inside the airways is what produces the uncontrollable coughing. Severe and persistent coughing attacks may result in vomiting, red or blue face, and fatigue. Adults and teenagers usually have a persistent hacking cough. Infants may not have a cough at all. Instead, they have a hard time breathing or even moments without breathing at all. This is called apnea, is when there's a pulse in breathing pattern. This is usually dangerous in babies. Since it is a bacterial infection, it can be treated with antibiotics, usually erythromycin. It's taken for 2 weeks. Over-the-counter medications are not recommended. In order to prevent this from occurring, the most effective way is to maintain immunization. If one has pertussis, they should stay away from children. And Marianne will come and cover purpose and method.
Okay, so the purpose of the study, it was performed at a health center in Fairfield, South Wales, Australia. In Australia, whooping cough continues to be the most common vaccine in preventing disease, preventable disease. A trend of epidemics occurs every 3 to 5 years. In 2013, approximately 5,000 cases of whooping cough were reported in Australia, noting the highest rates in children less than a year. Vaccination wanes 5 to 10 years after receiving the whooping cough vaccine. This range of vaccination immunity leaves adults and adolescents vulnerable to infection. When infected with whooping cough, the natural immunity post-infection does not offer lifelong immunity. An observational study by the CDC suggests that natural immunity post-infection of whooping cough can last between 4 to 10 years. This is why routine vaccination is important to help prevent infection and the spread of disease, especially for those who are most at risk. The implementation of the whooping cough booster with the antigens for tetanus and diphtheria has been available in Australia since 2001, with application placed in scheduled vaccination for adolescents aged 15 to 17 years of age. Important recommendations by the New South Wales Department of Health released reports in 2003 suggesting that employees that have close direct contact with infants should have a single dose of whooping cough booster. In the past, employees have had low rates of vaccination immunity and low compliance to have recommended vaccination updates. So the purpose of the study was to assess the status of Fairfield Health Services whooping cough vaccination and the knowledge and attitudes that healthcare workers have towards the whooping cough vaccination. The results from the study would be used to assist in adopting health policy for whooping cough. And the method of the study consisted of 182 healthcare workers of the Fairfield Health Center who had direct contact with children and were issued a self-administered survey questionnaire. The survey was 4 pages, front and back, with 9 items and divided into 4 parts. The first section gathered information about the respondent's role and the area of work in the health center. The second question about the whooping cough vaccination status, past history of whooping cough exposure, infection, and history of prolonged cough in the past. And the third included 7 statements about whooping cough and vaccinations for whooping cough with a 5-point Likert scale from strongly agree to strongly disagree. And there was a do not know option was also listed. The final question asked the respondents where they would go for vaccination and an area to explain reasons for non-attendance of vaccination. The questionnaires were sent out to a group of public health trainees as a pilot study. The questionnaire was approved by the Ethics Department of the Southwestern Sydney Area Health Service and Fairfield Immunization Task Force. A cover letter was included which explained the purpose of the study, and the survey was given in person and attached to the paychecks of the employees. After 2 weeks, a second mail out to all the non-respondents were sent out. The data collection was analyzed by the use of the SPSS software for descriptive odds ratio. The like scores were reduced to dichotomous variables, and the use of the Mantel-Haenszel method was used to calculate the adjusted odds ratio. The consideration of statistical significance was based on a p-value less than 0.05. For the results, out of 182 staff contacted, only 132 completed the questionnaire, which gives a response rate of 74%. Of the respondents, 42% worked primarily with pediatric patients in the areas of children's units and early childhood and parenting services. Only 1 doctor worked in the pediatric area. The remaining of the staff worked in the mixed patient loads of emergency department and maternity units. Of the non-respondents, a majority were from the emergency department and antenatal and maternity units. The research did not have any further information on the non-respondents, and the rates of immunization varied between the professional and areas in which they work. Physicians were found to be more likely to be compromised compared to nurses and allied health, with 59% of doctors. Staff working in pediatric units, 25% were known to be immunized against whooping cough compared to the 42% working in non-pediatric units. Of the staff that cared for patients with whooping cough were not known to have been immunized with the vaccine. Employee working while having a cough lasting more than 2 weeks or more, 85% while working experienced a cough in the last 12 months. Of the 17 healthcare workers, 16 knew that whooping cough can be transmitted to patients.
In the section of the survey with statements covered, 19% believed that it is not necessary to be vaccinated with whooping cough because it's believed to be a benign and self-limiting. The recognition of vaccination coverage providing lifelong protection was 39%. Babies being the only ones who are mainly at risk, so that makes it 19%. The majority of the staff acknowledged that the contraction of whooping cough from patients was 90%, and patients at risk of contracting whooping cough from healthcare staff was 87%. 57% of the respondents were not aware that infants were more likely to have contracted whooping cough from an adult relative. It was found that 78% respondents believe that healthcare workers can catch whooping cough from patients that suggest that a booster should be offered, with a 31% who disagree. It was found that 79% agree that patients can catch whooping cough from healthcare workers and recommended that a booster should be offered. So in conclusion, the study proved that healthcare workers have a low rate of immunity to whooping cough and misunderstandings about whooping cough, infection, and immunization. Over a quarter of the healthcare workers did not agree that a booster should be obtainable. Due to the results and how the healthcare workers responded to the survey about the immunity of whooping cough, an ongoing education program is being held to address the attitudes and the misunderstandings identified in the study. It is an important factor of the movement increase the approval of adults whooping cough booster immunization in the healthcare worker. So this is our presentation. Again, I'm Jen Rojas.
And I'm Marianne.
Thank you for listening. Hope you enjoyed it.
Thank you.